your shoulder blade plays a role with your pelvic floor dysfunction. Yep, you heard me right. So most often people, when it comes to pelvic floor dysfunction, they look at the pelvic floor, and here I am telling you, broaden the lens and look at the whole body. Let me explain. There is a condition called scapular dyskinesis, just a fancy name to say your shoulder blade is not moving properly over your body. So I'm going to show you the side view of myself. So typically, given our lifestyle, this is our pattern because we're typing or we're looking down and doing this. When the shoulder blade is rolled forward, or because you don't want to be one of these people, you hyperextend and you stick your chest bone outward, you are altering what is sitting on your pelvis. Right here is where the spine is connected. So alteration of your mid-back area influences your pelvic positioning or there. So it causes posterior tilt or anterior tilt. No one stays in a posterior all the time or anterior all the time. They switch between anterior and posterior, resuming anterior pelvis or posterior pelvis more than the other one. So when we start addressing the tightness, because typically people go to see pelvic floor therapists as a result of symptoms related to the inside, failing to realize the inside doesn't just randomly become tight or weak, but it's responding to external factors. And then perhaps they're looking at that and maybe addressing the breathing and some posture. They're failing to realize that their shoulder blade positioning is in fact influencing the position of their pelvis and how inside the pelvis is responding to this type of instability in the pelvis. It always sucks when your problem is much deeper than you think it is. No one wants to hear that, but just because you don't want to hear it doesn't make it go away. So what I'm suggesting here is broaden the lens of assessing what's contributing. Ask the why until you get to the core. And in my opinion, when it comes to pelvic floor dysfunction, the why is always broad-based, meaning your whole posture gives it away quite a bit. So for us to go address just the tightness inside the pelvis, as far as how far this finger goes, is really limiting what it is that we need to do. What I'm suggesting is go beyond what the manual internal work is to really see why the muscles on the inside got tight or weak and how to take away what led to that issue. I hope this made sense. To me, it makes total sense. And that's the approach in our practice when it comes to treatment of pelvic floor dysfunction. Pelvic stability has to be present. There are pelvic floor issues, pelvic floor dysfunctions that are nerve related. Sometimes it's organ related. There are other factors that play a role. You can't have more than one thing leading to the same end result of pelvic floor dysfunction. Pelvic instability is always part of that picture, regardless of what else is happening. That has been my experience with patients that I see, and I've been in practice for so long that I rely heavily on my own experience. Sounds cocky perhaps, but I don't mean to be cocky. I'm just telling you the truth. I've been in practice for 30 years and I've seen many patients and I see the patterns that are present. I hope you look into this. I hope you utilize the internet and in furthering your own education. And if you have any questions, I invite you to contact my practice and set up an appointment. Until next time, take care.